Hello, I'm Dr. Soumya, gynecologist at Akkineni Hospital. Hope you're in good health. Let's discuss some essential points today. Stay with us and make notes.
Hello and welcome. Today we're going to be talking about a really critical health topic, ectopic pregnancy. We're going to break down the signs, the symptoms, and what it all means because, honestly, understanding this is so important. So let's start with the central question. What actually happens when a pregnancy begins in the wrong place? This is the very essence of an ectopic pregnancy. And while it only affects a small percentage of pregnancies, maybe 1 to 2%, getting a handle on it is vital. Why? Because being aware of the signs can literally be life-saving. Okay, so what does ectopic even mean? Well, it literally just means out of place. An ectopic pregnancy is when a fertilized egg implants and starts to grow somewhere other than the main part of the uterus, a place that just isn't built to support a pregnancy. To really get why this is so serious, we first need to understand that fundamental difference in where the pregnancy actually takes root. It's all about location, location, location. This slide really lays it out perfectly. On one side, you've got a normal pregnancy. The embryo is safely inside the uterus, which is this amazing organ designed to stretch and nurture a growing baby. But on the other side, the embryo has implanted somewhere that just wasn't built for that job. And that's what creates such a dangerous situation. And get this, in about 95% of cases, that wrong place is one of the fallopian tubes. It can technically happen in other places like an ovary or the cervix, but the vast majority of the time, we're talking about what's called a tubal pregnancy. So why? Why is that location so dangerous? Understanding this piece of the puzzle is the key to grasping just how urgent this condition is. Here's the critical point. The uterus is a muscle. It's designed to expand. The fallopian tube, though, it's a very delicate, thin structure. It's not meant to stretch. So as the pregnancy grows, it pushes the tube to its absolute limit, which can cause it to tear or even burst. And that rupture leads to severe internal bleeding, which is a true medical emergency. And this really puts that risk into perspective. Even though it's relatively uncommon, ectopic pregnancy is a leading cause of maternal death in the first trimester. And it's not because it can't be treated. It absolutely can. The real challenge is recognizing the signs early enough to get help. So that brings us to what might be the most important part of this whole explainer. Knowing what to look for can make all the difference in the world. And the symptoms, well, they can range from something really subtle to a clear, blaring emergency signal. You know, at first, the signs can be so confusing. They can look a lot like a normal early pregnancy or even just your period. You might have a missed period, maybe some light spotting, and some mild pain in your lower belly, often just on one side. It is so easy to brush these off, but these are the very first clues that something might be wrong. But if the tube ruptures, the symptoms become impossible to ignore. We are talking about sudden, sharp, severe pain in your abdomen, and a really classic telling sign is pain in the tip of your shoulder. Now, that might sound strange, but it's caused by internal bleeding that irritates a nerve that runs up to your shoulder. Dizziness, feeling faint, those are major red flags. These are not wait-and-see symptoms. They mean you need to get medical help immediately. So, you might be wondering, are some people more at risk? And the answer is yes. Things like having a previous ectopic pregnancy or a history of pelvic inflammatory disease or certain surgeries, they can increase the chances. But, and this is so important, an ectopic pregnancy can happen to absolutely anyone, even with zero risk factors. Okay, so let's say you have symptoms and you do the right thing. You go get help. What can you expect? Well, the medical process is designed to be fast, clear, and safe. Usually, it's a 3-step process. It starts with a doctor just talking to you and doing an evaluation. Then, they'll do a blood test to check your levels of the pregnancy hormone HCG. See, in a normal pregnancy, those levels tend to double about every 48 hours. If the pattern is off, that's a big red flag. And finally, a transvaginal ultrasound gives the doctors a clear picture so they can see exactly where the pregnancy is located. Once it's confirmed, there are 2 main paths for treatment. If it's caught really early and everything's stable, a medication can be used to stop the pregnancy cells from growing any further. But in more advanced cases, or if a rupture has already happened, surgery is needed to remove the ectopic pregnancy. The goal for both is exactly the same, to safely resolve this dangerous situation and protect your health. We've covered a lot of ground here, from the biology to the symptoms. But if you only remember one thing from our entire chat today, please let it be this next slide. This is it. This is the key takeaway. Don't try to second guess it. Don't wait it out. If you're in the early stages of pregnancy and you experience any weird pain or unusual bleeding, getting it checked out right away is the single most important thing you can do. It's not just a precaution, it can save your life and also help protect your ability to have children in the future. And that leaves us with this final thought. How can we all better support early detection? Well, the answer's pretty simple: by sharing this kind of information. When we understand the signs, when we trust our instincts, and when we encourage others to seek help without delay, we empower ourselves and everyone we care about. We turn awareness into action, and that's what saves lives.